Hello, everyone. Good evening. And how has your week been? Dr. Timi and I are back again with another endometriosis awareness session. So, for people who don't know what exactly is endometriosis, endometriosis is the abnormal growth of cells similar to those that are inside of the uterus, but in locations outside the uterus. So, it's a chronic disorder affecting not only just the reproductive system, but it's a whole body disease. So, as we speak about chronic illness, I chanced upon this beautiful poem by M. Roy, which stands so true. People assume you aren't sick unless they see the sickness on your skin, like the scars forming a map all the way you are hurting. My heart is a prison of have you tried? Have you tried exercising? Have you tried eating better? Have you tried not being sad, not being sick? Have you tried being more like me? Or have you tried shutting up? Yes, I've tried, and yes, I'm still trying, and I'm still sick. Sometimes monsters are invisible, and sometimes demons attack you from inside. Just because you cannot see the claws and the teeth does not mean they aren't ripping me through. Pain does not need to be seen to be felt. Telling me there is no problem won't solve the problem. This is not how miracles are born. This is not how sickness works. Isn't it beautiful? I had goosebumps when I read this because it actually says my story and a story of a lot of other people like me suffering with endometriosis. So today we have with us Shruti Chopra, the warrior princess in the truest sense. She's been an endometriosis patient for the past 25 years and has been battling a host of chronic illnesses associated with it. She is the founder of All Things Endometriosis, a website that has everything about endometriosis. You must check that out. Welcome, Shruti, and hi, Vimi.
Hi, Shilpa. Hi, Shruti. Hi, Vimi. Hi, Shilpa. Thank you for that. And yes, a very apt poem for sure. I think it's really sad that we have to physically show what's wrong with us for us to be believed. But yes, perfect poem.
Oh, I had goosebumps. I literally had goosebumps when I read that. And I was like, who would know it better than you? You know?
Very true.
So Shruti, to start with our session, I would want to, why don't you just tell us a little about your childhood, the time you probably started having your period?
So I started my periods when I was 11 years old. And it was also a month before I joined secondary education in London. So I was studying there, was brought up there, and I had a vague idea of what periods are, because one very good thing about the English education system is that you are taught about the reproductive organs when you're around 10, 11. You're told what periods are, you're told what safe sex is, you're told a lot of things that you would feel and what you should not feel. School starts in September, and in August, when I was 11, is when my periods began, and they hurt so much. For someone like me who loved going to school, suddenly a month away from starting a new school, was scared that how will I manage so much pain? It was extremely painful, and pain which, as an 11-year-old, if you've never experienced, it was tough. It was very tough to take. But thankfully and unfortunately, my mom knew exactly what that pain meant. As someone who has dealt with fibroids, who has dealt with adenomyosis, who's dealt with endometriosis, she knew that she went through that as a child herself. She did not want me to not be believed. So she was my first advocate when we would go see the doctor. So my mom, within the first 2-3 months of me going through a lot of pain, took me to the general practitioner right away and said, basically, my daughter is suffering from periods. And the first thing that a general practitioner tells a very young girl is that it's just started. You will grow out of it. Just give it a few more months and everything will be fine. Your body is adjusting to it. And that's what you're told. Well, that's what I was told. And I've come across a lot of people who are told very similar things.
Similar things, yeah.
Yeah, so that's how, that's when my first period happened, and the first period in itself was so painful.
All right. So, Vimi, is there any particular age post which endometriosis can happen, or it can strike at any age?
Before I go into this, Shilpa, as Shruti said, this normalizing the symptoms is very, very common practice. It happens everywhere, Shruti. Like all the patients who have come to us, they tell us that they were told that this is normal, you grow up, you'll be fine, or you get married, have children, you'll be fine. So normally normalizing the symptoms should not happen, and it has a very huge psychological impact on the growing mind. They start thinking that they can't handle it, while all other my friends and other classmates can handle it so well. I'm the one who is not able to handle it. So this, especially in the adolescent age group, should not happen when they are dealing it for the first time and first few months of their periods. It's really hard to overcome that pain and trauma what they go through. Now, endometriosis usually is considered as a reproductive age group disease, but that's not true. And no age group is spared from it. It can be found in teenage group, middle age group, and people think that menopause removes this disease, or after menopause you can't have endometriosis, and that's not true. So postmenopausal women can have endometriosis. You remove the uterus, you can have endometriosis. Endometriosis we have seen in all age groups, and Dr. David Redwine has also reported endometriosis in a fetus as well. So nobody can say that which age group it is confined to, but yes, most common age group is the middle age group, but it is widely prevalent. It goes undiagnosed in the early age groups. Like Shruti was dismissed. Shruti was told that nothing is there. But if she was investigated a little early, they would have diagnosed a teenage endometriosis. So when she grows up, she will be diagnosed a little later. So this is a biased thing. All age groups are affected with endometriosis. There is nothing that it does not happen after the periods, or it does not happen before you start the periods. Even pre-pubertal girls have reported endometriosis. So this is a disease which whenever we are dealing with it, we have to, like when we say ectopic pregnancy, we should be ectopic minded to detect it. We should be endometriosis minded to detect endometriosis actually. Until unless you suspect it, you can't find out.
Absolutely. So that's what I was just about to say, that it is probably diagnosed much later. That's the reason it is said that it's a reproductive age disease,
group.
you know, because all of us probably have taken at least 7, 8, 9 years to get diagnosed. So obviously a teenage girl would become a girl in 20s or mid 20s, you know, it's very obvious. So Shruti, so how long did it take for you to get diagnosed with endometriosis, and how did you get diagnosed?
I think I was very lucky, and I did not realize that until much later, when I got to know that the average is 7.5 years for someone to be diagnosed with endometriosis. And like I said, my mom was very strong that no, something is wrong. So after the first 3 periods, with the general practitioner dismissing it, we waited another month at the most, and then we went back again, and he was, we sort of insisted that, you know, this isn't feeling right. Something definitely must be wrong. Can we do something else about it? And in the UK, you need to be referred from your general practitioner. You can't, like here, just go to another doctor and just get an appointment, and it's so much more convenient. You have to be referred. You just can't go in. So I got referred to the gynecology department in one of the hospitals in London, and they were very good in that sense. They were very clear that they got my hormonal blood tests done, they got an ultrasound done for me, and they made sure that I was well investigated. In the investigations, my hormone levels were all over the place. Testosterone was definitely extremely high. There was, I had bulky ovaries, which is known for polycystic ovarian syndrome as well. But at the same time, the gynecologist there heavily suspected endometriosis. And it's because Dr. Vimi said that if you're looking for it, you will find it. But if you're choosing not to look for it, you will always dismiss that the fact that it exists. And I was very lucky that way. They thought I was too young for a diagnostic laparoscopy at that age, because by the time we went through the referral, I was already 12 years old, but they thought I was still too young for a diagnostic laparoscopy. But they always treated me as if I had endometriosis. Every treatment plan that was laid out in front of me was keeping in mind that this girl could possibly have endometriosis. So even though I was not diagnosed until my actual diagnostic laparoscopy, which was when I was 16, but for those 5 years, I I was made to believe I have endometriosis and I have polycystic ovarian syndrome, and that gave me confidence. It didn't feel like it was in my head. My mom grew up being told it's in your head, so she had heard those things. So for her, those were red flags. And if she had ever heard it from the general practitioner, we would come home, we would discuss it, and I'm someone who can. I'm more vocal than my mother. So taking support from what she said, I was able to advocate for myself from the age of 11, which is why I think I was able to push and get an earlier diagnosis or a suspected diagnosis.
True. So for you, I think that was like your mom having your by your side as an advocate would
Yes.
have been like a big help to you.
Yes.
I'm sure about it. I,
Yes.
I mean, I think that's like one of the best things that would have happened to you for getting a diagnosis.
Absolutely.
Otherwise, it's a pain.
And to answer your question, how did I actually get the final diagnosis? Was that I had a diagnostic laparoscopy at age 16. But it was an ablation surgery. It was what was available at that time. It was the standard procedure that was done. And so let's say I had my ablation between my 10th exams, and then the periods were okay for, let's say, 2 or 3 cycles. They were better. Firstly, it was extremely painful. I mean, laughing is such a problem once you've had that surgery, and to go through exams at the same time. And I had a good couple of cycles, which then I guess it just didn't work very well for me. But they tested the tissue and it was confirmed that I had endometriosis. So that's how I got my diagnosis.
All right. So once you got your diagnosis, what were you suggested? And were you clear about what exactly is endometriosis? And in a sense, what exactly is happening to your body with endometriosis?
So one good thing is I was going to a school at the age of when internet was picking up. And it was easy to type endometriosis and get to research and read, along with the fact that, again, I think I would commend the fact that hospitals tend to carry very good literature on different subjects, and your doctor wants you to be educated about what's happening with you. So they're very happy to explain. I have found with some doctors that until you don't ask, they don't tell you. I was privileged enough that the doctor I had, she would be happy to explain. And I think because I was very young, she didn't want me to be scared. And because she didn't want me to be scared, she was very happily explaining everything in a very simple way. And that made things easier for me. And it gave me a starting point to be able to research and learn about endometriosis. So I was never scared of the condition. I hated the pain. I hated every symptom I went through, but I was never scared of it. I think I was a little proud of the fact that I knew what's wrong with it. And as for treatment plans, because I was very young, initial treatment plans were all about giving the pill. Initially, I was given a high estrogen pill, and high estrogen contraceptive pills tend to cause a lot of breast tenderness. So I went through severe breast tenderness to the point if I was breathing and my breast moved, I would be in tears. I couldn't have a hug. I couldn't wear my school shirt. I couldn't wear the sweater on top because it's London and it gets cold. So I suffered for many months before the doctor realized that, okay, it's high estrogen, that's what's troubling her. So they changed the pill. Um, the pill is really, I mean, I could be wrong here, but the pill, at that time, I was told to regulate periods and probably reduce the symptoms. For me, it never reduced my symptoms, and my periods were always very regular. So that's one thing. I never had irregular periods. I had very regular periods, just extreme heavy bleeding, extreme pain, extreme nausea, extreme diarrhea, extreme of loose motions, everything all happening at the same time. But they were nicely regular, and they did never left me for 1 month even. So
I can imagine.
yeah, so my treatment plan was a contraceptive pill. I was told to exercise, but when you're in school, you're exercising anyway. I was never fat. I never gained weight. My fat percentage was never high. So in that sense, that marker I all matched, that I didn't need to worry about certain other, but we couldn't get my hormones under control either. My testosterone was always high. It was high until I think I was 24, 25. Okay. So that's when I made changes and I saw a difference from whatever I've learned over the years.
So Vinny, tell us a little about excision surgery and how does it help a person with endometriosis with the pain?
As Shruti said that she had her ablation at 16 years, and I think that was around 20 years back. And that time, that was the prevalent practice. They used to take tissue and they used to burn the tissue, whatever endometriotic tissue they could see. Now with scientific evidence and with the studies, we saw that this was not helping the patients. And few doctors started removing complete endometriosis. They started scooping it out, like the lesion has a depth as well. It is not on the surface. It goes deep down inside the peritoneum and other organs as well. So if it is removed completely with the clear margins, that is what is called as excision. It can be anywhere. It can be on the peritoneum, it can be on the bowels, bladder, anywhere you name it. It can be on the diaphragm, undersurface of diaphragm, liver, anywhere. Most common place is the reproductive organs and the surrounding viscera like bladder and bowels. So it is basically a complete removal of the disease. That is what is excision, and ablation is the burning of the surface. But when we burn the surface, we leave the disease which is under the peritoneum. So that leaves the symptoms behind. And as it is a progressive disease, it produces its own estrogen and other hormones. It causes a lot of inflammation and scarring. So ablation is not working for patients. But when we do excision, we remove the tissue completely, we see very good results and they have a good quality of life and good disease-free interval. So ablation is basically just with different energy sources like monopolar, bipolar, we have plasma jet, we have different lasers, we burn the tissue from the superficial surface. So that we are advocating that it should not be practiced because it does not help much. Excision is completely scooping out the disease, completely removing it from the roots. So excision does help and it has very good outcomes in terms of fertility as well as quality of life. So that is what, and still if we look at the wider view, ablation is a widely prevalent practice because in medical colleges, we were never taught about excision. When we studied that time also, we were never taught about excision or endometriosis treatment should be changed or there is a change in practice. We were never taught about that. That's the reason the practitioners, when they're coming out, they're practicing what they have seen. So they're not removing the disease, they're trying to burn the disease. The small bluish spots or the red spots, different presentations can be there for endometriosis. Most common location is ovary, that may form a cyst called as endometrioma, or in general terms, it is called as chocolate cyst. So they remove the cyst or they drain the cyst and they try to ablate the tissue surrounding the cyst. But excision should be done. The cyst wall should also be excised along with the deep endometriosis, that is called as DIE, deep infiltrating endometriosis. Any endometriotic lesion which is extending more than 5 millimeter depth, that is called as DIE, and DIE lesions should be excised completely because none of the energy sources can go that deep and burn the tissue completely. So excision is basically completely scooping out the disease. And I think we have discussed this several times and we have tried to educate all our viewers. Maybe in the coming this thing, I'll share that slide again, how it is different from ablation and excision.
So excision, as we have always said, is the gold standard when it comes to endometriosis. So Shruti, you've gone through an excision and ablation both, if I'm not wrong.
Yes, yes.
Yeah. So as a person who has gone through both, can you tell our viewers what is the difference that you felt, with respect to your pain percentage? How would it differ in an ablation or an excision?
So, firstly, I had my ablation when I was 60, but I had my excision when I was 35. So
Okay.
there's an age difference with the two experiences as well. But after my ablation, within a few months, I was going through extreme heavy bleeding which I'd never experienced even before ablation. And my initial periods were lasting over a month at a time. I'd cross 40 days, 50 days. There was no way to stop the bleeding. So I basically hated the fact that I got ablation done. And it made my life really miserable. For someone who had regular periods at regular times, I know if it's starting on the 8th of the month in June, it'll be on 8th July. So that messed up for me. So getting back the person I was very difficult. I had come to a stage where 7-day period, but 10 days before that, my pain would start. So 17 days of the month, I was in pain. I had a good 10, 12 days, 13 days afterwards where I would plan my life. So I lived my life for 13 days. I soon came to a time when I just had a good 7 days. Then I came to a time when I had no good day left. And I spent 2 to 3 years researching on different doctors and learning more about excision, learning more about the procedure. I had seen a doctor in 2015. My excision ended up happening in 2009. It took that long for me to figure out the right doctor, somebody who was understanding me and my conditions. Also in 2015, I got sick with other conditions. So it pushed back my excision. After excision, I probably feel pain a day or two before my period. I have heavy bleeding maybe for the first 3 days, very heavy bleeding for the first 3 days. I'm now not going through heavy bleeding for the entire 7-8 days. So that's made a huge difference. So I'm facing pain first 2 days prior and the first 3 days. So from having no days to now having 25 days in a month is like
a blessing.
It is. It's like suddenly, like I want all my years back. Like I lost all of that. So my pain level has changed. The type of pain has changed. I am now not vomiting and having loose motions at the same time. And that has happened way too often, which makes you so weak, plus you're bleeding anyway. So I'm not experiencing any of that. I might experience a bit of nausea. I might need a hot water bottle and one painkiller for that particular period. I don't need a painkiller every single day and twice a day. I don't need to put myself through that. So yes, quality of life from post-ablation to post-excision is huge.
Great.
Is huge. I mean, I wish it was there when I was 16 and not when I was 35. So I would have had a lot more years.
I can imagine.
That's wonderful to know, Shruti. In community medicine, we used to study about disability adjusted life years.
Correct. Oh, yes.
But endometriosis is still not considered as a disease or properly. WHO is still not considering it. Many of the sites are still not mentioned on the ICD criteria as well. Now, endometriosis is such a debilitating disease. It is basically a disability. Women who cannot work for 25 days a month. What else you can call it? Before getting the treatment, that should be counted as disability adjusted life years, and there should be proper. They should address it properly. Actually. It's such a chronic illness which hampers your day-to-day activities. It should be addressed properly, and the higher organizations should consider it.
True. I mean, 25 days out of 30 days, and some people don't even have those 5 good days,
Yes, yes.
So and still it's not considered as a disability or as important.
Or as important as it should be given
No,
importance.
as important that more research needs to be done about treatment of this particular disease, which so many women are facing.
I think it becomes a gender issue as well.
Absolutely.
It's because it's women. You're supposed to bear it. Ye to sabko hota hai. Everybody deals with it. I mean, we dealt with it when we were having children, and we did this and we did that. So you should also suffer.
Correct.
And it's strange because sadly, it's not. It's also female doctors who can tell you that, that you should it's fine, just have a child, you'll be fine,
Have a child.
And I'm like, doctor, I'll have the child, great. Sambhalega kaun? Who will take care of the child when I'm going to be in pain?
No, that's what happened, Shruti. I mean, I remember, Bimi, you have known this. So when I was going to the doctor in tremendous pain, all the doctor was wanting to do is me having a child. I was like, who's going to take care of the child when I'm in pain throughout? I can't take care of the child, so please don't tell this to me. Tell me what should I do for the pain.
The problem is they don't treat women as an individual. They treat somebody's wife, somebody's daughter, somebody's daughter-in-law, somebody's mother.
Absolutely.
That is the problem comes.
So, the problem with me was, doctor, I am not anybody's wife. I'm not even married. And you're pushing me to have a child.
No, they treat you that you will be somebody's wife.
Exactly.
You will be somebody's mother.
True. So
they
my
look at
surgery...
your future. They are concerned about you, Shruti.
So my surgery did not happen because I was not married. So my doctor denied a surgery saying that, no, you're still not married. I do not suggest the surgery for you. Simple.
No, it's a taboo because in India, especially, I'll say the families get involved when we talking of a surgery to a girl or a woman.
Unmarried, yeah.
What happens is they can't take their own decision, first of all. Second is when a surgery involves the ovaries, uterus and tubes, it's a huge issue. Like the whole life of that girl is that producing a child.
Yes.
That is the problem. If
that's
that
the main
problem
thing.
is not eliminated, till then individualized care for that woman as a person is very difficult to deliver.
Not happen.
So the society also needs to change their mindset and they have to have a broader perspective on women's health.
Yes.
I'll quickly share that slide, Shilpa, for ablation and excision so that for people to understand. Now, if this is an endometriotic lesion, actually, if this is the endometriotic lesion, ablation is burning of this superficial one and we don't remove the roots. So this is what happens when a tissue is ablated. So if this is the endometriotic lesion with the roots under the peritoneum, so we here what we do is we excise the tissue
out
as deep as it is. So we get a clear margins of a healthy tissue and that gives very good results. This is what is the difference between ablation and excision.
Perfect. So, Shruti, what all complications? I know you had to go through a lot of other complications which came with endometriosis. What all complications did you have post, with endometriosis?
I think
besides endometriosis.
Yes. So in terms of medical complications, I don't know what comes first actually in this situation, whether it's triggered by endometriosis or it's the other things which add to the end or contribute to creating the endometriosis, because I guess we don't really know why endometriosis happens. So I have a condition called Ehlers-Danlos syndrome. It's a connective tissue disorder. There are multiple types of EDS, and I have the hypermobility type. It means that my connective tissue is more elongated. It stretches further, and it can cause a lot of pain, and it causes a lot of people disabilities. It causes dislocations in the joints. It causes severe pain in the joints. So I have EDS, and it is supposedly a genetic disorder, but the type that I have is there is currently no genetic marker found for it, whereas the other types do have a genetic marker. And it's something that it's pains I would complain of when I was 7, 8 years old. And I was told they're just growing pain. But again, if you look at a lot of people who have had EDS, they are always told when they're young that they are just having growing pains. So they do say EDS contributes to endometriosis, because again, it is related to tissue. That's one thing. Then I have painful bladder syndrome, which is that as a symptom, my bladder hurts a lot before peeing, after peeing. If my bladder fills up even a little bit, my stomach will hurt. I'll feel the pressure. It gets worse during periods, as if everything is worse. Like even my bowel movements are worse during my periods. It just seems like there's so much more pressure in those areas. And I'm trying to think of my list. I have adenomyosis also. And so I'm sure doctor would explain adenomyosis way better than I would be able to. And I have osteopenia in a lot of my body, but there are certain areas like my lower back, my pelvis, I have osteoporosis. It's my bones are a lot weaker in that region, which I am so sure does not make period pain any less. I'm sure it worsens it. I'm trying to think of I have arthritis in various joints, my fingers and stuff. So I think all of this makes everything so much more worse for me when I have my periods, because the body is so much more sensitive when you are having your period that every pain is heightened.
Aggravated.
And so, yeah, and I mentioned polycystic ovarian syndrome before, which comes with its own set of symptoms and complications.
True. That's like a long list.
I think I've like missed out half of it and suddenly I've gone blank as to what all I have.
And they say that endometriosis is a reproductive disorder. Trust me, it is not.
Yeah, it is. It's very, very strange. I had my excision surgery. My surgeon was aware that I have EDS, Ehlers-Danlos syndrome. So when you don't heal very well if you have a connective tissue disorder. So when you're performing surgery, which is so invasive, you're going to the bladder area. There was endo on my bowels. There were multiple areas where they found a lot of deep endometriosis. And I also had a hernia, which has never been picked up, even considering it was a hernia from birth. It was never picked up in my first ablation surgery, which is very surprising. So there was so much to deal with, but my surgeon came out and told me that your insides were so much more elongated. There was so much more to deal with because the tissue was stretchier. It was harder to get through, manipulate it. And my recovery, which should have been anywhere from 6 weeks to 3 months, took me over a year to recover from that surgery because my healing is so much slower. So, and it takes courage, I think, from an excision surgery specialist to take on a case where you know you're going to be dealing with a patient who could bleed, who could have internal bleedings if they don't heal properly, or if they don't take good aftercare. And I think people do not realize that it is an invasive surgery. It requires a lot of aftercare. You have to be so careful about your movements, your straining, your twisting, your lifting. And we just think surgeries happen, you'll be fine. But when you have other issues, it can get so much more complicated.
Absolutely. That is like crazy. That's what my next question was about it only, but I think you've already answered that. So you were also diagnosed with painful bladder syndrome. So how did you get the diagnosis for it? Because a lot of people don't get a diagnosis. And how does it affect your day-to-day life?
Right. So I'm someone who supposedly had a lot of UTIs. And I was constantly itching, having painful urination, burning. I was to the point that for 4 to 5 months, I was crying because I just could not take it. I did not sleep for all those months because I was suffering so bad. I would try these weird home remedies at night, which would give me some relief so I could get some sleep. And I would usually be given an ointment, an antibiotics course. I would be fine for a short while and then it would come back again. And I'm someone who's very careful. I don't go to public toilets. I make sure that I am hygienic. I could get this wrong, but the vaginal area is a self-cleansing space. So I shouldn't need to really interfere with it. I was getting fed up. I was just a few months away from my excision surgery. I went to when I was having my excision surgery. Before that, I let my surgeon know. Pre-surgery testing is usually done. That also showed apparently a UTI, and I was given medication for it. My excision surgery was over, a couple of months passed. My UTI was just not getting better. I saw a urologist, a specialist. I went to him and I said, please just give me the right ointment or the right medication. I cannot take it. He said, I'm sorry. I'm not giving you any ointment, any medication, because you don't have a UTI. You have a history of endometriosis. This cannot be a UTI. This has to be a painful bladder syndrome. I said, this is ridiculous. My UTI is showing up in my urine test. Please just give me the medication. He's like, that's a short-term solution. He told me that women usually take the urine sample incorrectly. And he explained how to clean the area, how to give a urine sample. And he said, then come back with the result. And it was clear I didn't have a UTI. And he gave me medication for painful bladder syndrome because he heavily suspected that. He did do an ultrasound, and the medication helped me. And that in itself is the answer, that if the medication for painful bladder syndrome is helping me, that was why it was happening. And I think it's now been over 2 years. I've not experienced UTI symptoms. And it was later found out that I have painful bladder syndrome, possibly because I have mast cell activation syndrome, which is you are allergic to things, and it's a form of allergies where your mast cells activate due to surroundings or food or dust, and that is connected with endometriosis and it's connected with painful bladder syndrome.
My God.
I mean, when you start going into it, the body is one. So I'm assuming all issues tend to be connected.
Correct. Makes sense. But kudos to your doctor who actually diagnosed it and made things better for you.
Yes.
I can't imagine not being able to sleep through the night. It must have been like crazy.
Yes.
Oh my God. Okay. That was like a long... I really don't know. That's the reason probably I called you the warrior princess. To deal with so much with that smile on your face, I think hats off to you.
No, really hats off to you.
Absolutely.
Chronic illnesses you're dealing with.
It's not easy.
Not easy.
So
you were also given GnRH analogs?
Sorry, what is that?
Luperides or something.
Gonadotropins.
Lupiride.
I was for endo.
Yes.
I was on Lupron injections once. That's the only other treatment I've ever done. I was on a 3-month cycle, so I took it for 3 months. I hated the experience. Unfortunately, I was never told of the side effects that come with it, and I was never told it weakens your bone.
Yes.
Osteopenia and osteoporosis.
Yes.
That's why I asked you, were you given that?
And those are permanent side effects.
Yes. And I was never told about it. I was never even given supplements along with it to help me out. So now, because I have EDS, along with EDS, I have a condition. Now I'm remembering my conditions. I have a condition called POTS. It's a dysautonomia. It makes my blood pressure drops and I tend to have falls. So now when I fall, I have fractured my tailbone so many times. Now it's in pieces. So every time it heals, it's healing incorrectly because it's now so fragmented because of the osteoporosis. So, and that's basically happened as a side effect of Lupron.
That's right. Absolutely. And doctors, the worst thing is they don't tell the side effects. Even I was not prescribed any supplements with it. It's luckily I took it. But I don't know. But those side effects would always remain. The bone pain and all that stuff is something which comes with it. It's something which you can't help it, So you have osteoporosis. So what have you been doing? I mean, I know you are into you did a lot of lifestyle modifications. So what lifestyle modifications did you do to help yourself with osteoporosis and things coming with it?
Since around 2014-15, I made changes to my diet. I made sure that I wasn't eating foods that were added inflammation. So I added a lot more anti-inflammatory foods, at least foods that did not contribute to my pain. I mean, I wanted to do everything I could to make sure that I was doing things to reduce the pain. So, for example, I removed gluten from my diet because that was making life difficult for me. And I did see a difference from removing gluten. I have reduced dairy. I haven't eliminated it completely because of the osteoporosis. I never ate red meat, so it wasn't something I was gonna miss from not having it. And I don't have things which have hormones injected in them. For example, like chicken or any other meat that's out there. So I try to be very careful. I'm very mindful about when I'm going somewhere, or even when I'm at home, I prepare a list of things that I would like to eat for the week. When I'm ordering my groceries or my vegetables, I'm conscious about what I am ordering, what I can make from it, and does it give me the nutritional levels I need and does not contribute to my pain. So my food has been a huge thing for me. I would have loved to have had a better exercise regime, which unfortunately I can't because of the issues with my leg. I am disabled. I do use walking sticks to walk, but I do make sure that I walk at home. I try and get movement going. I have gone through pelvic floor therapy. Sorry, that's my dog. Just 1 second. Are you okay? He's fine. Pelvic floor therapy is something that I've gone through, and I still do it. I did it as a part of pre-surgery for a year before surgery to strengthen my abdomen, so that post-surgery, when I'm not able to do it for many months, I've given my at least lower back something to go by. Because I think when you are cutting for excision surgery, you're cutting through muscle wall of the abdomen, and that is going to weaken your muscles. So the idea was, if I am going to do this surgery, I am going to go in very well prepared. And so it meant changing my diet. It meant getting pelvic floor therapy done. It meant sitting with my physiotherapist who works on my legs to figure out what we can do to give myself the best possible position when I come out of surgery. So that's something that we really worked on. And because I was not having my surgery in India, I was not going to have my physiotherapist with me. So he trained me through everything so that I would be able to do that post-surgery, and I continued that. So the type of exercise, my food, and I think those two things have made a massive difference from what I can think of at the top of my head.
Absolutely. That's something which all of us have to go through, the food, we did a session on diet also, Vimi. You remember we spoke about anti-inflammatory diet and the way it really changes the ball game. It's something which will not cure you of your endometriosis, but at least it'll reduce the amount of flare-ups that you have. So, Shruti, you yourself being an endometriosis patient, how did you decide on becoming an advocate for endometriosis? And what did you do about it?
So it was an interesting conversation I was having with a friend of mine. People go to school, they go to college, they become graduates, they do post-graduation. They know what they are going to be. They're working towards becoming something in a certain profession. I was never able to complete my education because of my endometriosis. I was not, after I did, I think my first year of college, I was not able to go ahead and graduate in a profession that I was interested in because my pain was so bad. It took many years for me to reconcile with the fact that this is getting so difficult for me. I have, luckily, I've had opportunities where I've done different types of work, but a few years ago, I told myself that, hey, my life has become my degree. It's what I have earned all these years. I have lived this. So I am going to do what I can that people get to learn what I've gone through in the hope that they will be able to get something from it. I mean, all our bodies are different. Endometriosis affects us all so differently. But in the hope that even a percentage might resonate with somebody else, that's what I wanted to do. Because I thought it was pretty wasteful if I spent 25, 26 years dealing with a condition and I'm so experienced with it that I don't end up putting it to good use. What's the point of all that reading and torturing my doctors with asking for information, the dietitian, the physiotherapist, if I cannot share it? So I've been doing that for a few years. I've done it all my life, but I've put it out there through my blog and my YouTube channel in the last few years. So that was the reason why I wanted to do it, because it's what's the point of me suffering so much? I hope I can get somebody to suffer less. So that's the whole point.
Makes sense. Makes complete sense. So folks, you guys have to check her website, All Things Endometriosis. I was going through it and it is amazing. The kind of work that you have done, Shruti, is like lovely.
Thank you.
Your
website only, actually, Shruti.
Sorry?
I found you through your website only.
Nice.
Just I was searching something and then I came across your website.
So,
nice.
So Shruti, I follow Shruti on Insta. Yeah. So I've been following her work. So for a while, I initially before Vimi told me, I didn't know that you are the same Shruti that I was following. So anyways,
the problem is we have advocates everywhere in UK, US, but in India, hardly people come out, and once they are done with the surgery, they are
don't
okay.
talk about it.
Done.
Talk about it. It's like a taboo subject.
Yes. They don't want to talk about it. They don't want to discuss about periods. It's done.
People don't want to discuss a very important point with endometriosis is painful sex. I mean, that's something they don't want to discuss either. I mean, it's like, oh no, what are you talking about? So it's a very important subject, and women have to deal with that.
True.
So so we don't talk about it in India.
Yeah, absolutely. It's like a big taboo. Anything that happens in the bedroom remains behind the doors. That's about it. And women just endure all the pain and suffering. That's how it is.
Yep.
Now, we started telling our patients who have undergone the surgeries, at least spread the message, talk to others, tell about it.
True. So, Shruti, what next? Now that you were telling us that adenomyosis is suspected.
Yes.
What's the plan of action?
2015, I had an MRI which showed adenomyosis, and so the idea was, when I was speaking with my excision surgery specialist, was let's first tackle the endometriosis. We will know how much the adenomyosis is actually contributing to your pain, because the only real way to deal with adenomyosis, if it's extremely severe, is to have a hysterectomy. And I wasn't sure, because his suggestion was maybe a full hysterectomy. Our discussion was that if that's something that we're going to do, you're reducing the amount of estrogen that your body produces, and with weak bones, I am going to make life tougher for me further. So, so the idea was, let's first deal with excision. Let's get that out of the way, and then we will see what to do with the adenomyosis as it progresses. So as of now, it's just me sticking with my lifestyle, the better lifestyle decisions, and I've just basically recovered from the excision surgery, and I just want to get back into having enjoying these days that I'm getting right now.
Absolutely. So, Vimi, what happens when a person has adenomyosis?
As endometriosis, we already discussed that this is a tissue similar to uterine lining which gets implanted outside and where it does not belong. That is endometriosis. The same kind of tissue, when it starts invading the muscle layer of uterus, is called as adenomyosis. Endometriosis can occur alone, or adenomyosis can also occur alone, but both can occur together as well. So there we have to decide the treatment tailored to the patient needs actually. One size does not fit all, as we say in endometriosis. So we have to decide their treatment options depending on their age, their symptoms, their requirements. Now, adenomyosis can be of various types. Adenomyosis can be it may involve the whole of the uterus, that is called as diffuse adenomyosis. It may involve a part of the uterus like a swelling, which is similar to fibroid, and it gets misdiagnosed as fibroid most of the cases. That is called as adenomyoma. And there can be a extension of deep infiltrating endometriosis onto the surface of the uterus, that is called as focal adenomyosis of outer myometrium. So these are the three different types. Now, focal adenomyosis of outer myometrium is absolutely on the surface of the uterus, and it can be easily removed when we do the excision surgery. But a diffuse adenomyosis and an adenomyoma, and we don't remove or we don't jump onto the surgery unless it is really indicated. If a patient has severe symptoms and she's of the younger age group where hysterectomy cannot be advised, adenomyomectomy is an option. Or she's looking for fertility and she had recurrent IVF failures or recurrent implantation failures or recurrent miscarriages, their adenomyomectomy helps. The definitive option is definitely a hysterectomy because the disease is in the organ. Endometriosis is outside the uterus, so removing the uterus does not help endometriosis. But adenomyosis is in the uterus, so removing the uterus does help. But here I would like to mention that if you have endometriosis and adenomyosis both, only removing the uterus will not help you. So talk to your doctor when you are discussing all the options. When you are removing the uterus, discuss about excision of the endometriosis as well, if you are a candidate for hysterectomy.
True.
So adenomyosis is basically an endometriosis of the uterus, which usually presents with painful periods, heavy bleeding. Sometimes the adenomyoma or adenomyosis may be too big that they feel like a lump, bloating, fatigue. All these symptoms are there. They feel heaviness in the abdomen. Sometimes they describe their movements as like some ball is moving around. So some of the symptoms do match with the fibroids. And focal adenomyosis always gets misdiagnosed as fibroid uterus. And this poses a surgical challenge because removing a fibroid is easier in laparoscopy and removing an adenomyoma is not that easy because the tissue planes are not separate. It is a part of the uterus. And if we post a patient for myomectomy and we find an adenomyoma, usually, as I said, adenomyomectomy we don't do until unless it is really indicated. But myomectomy is a very, very common surgery where we remove the fibroids. Mm-hmm. So we may get stuck when we post a patient for myomectomy and the diagnosis is adenomyoma. So these are the surgical challenges we might face because patient counseling will be different. The aspects of the future prospects for the future fertility will be different. Adenomyomectomy definitely carries a little more risk of uterine rupture during pregnancy as compared to myomectomy. So these are the things we need to explain to them. But with good imaging modalities and with good sonologists, differentiating adenomyosis and fibroid is very easy, and we should be able to differentiate it before we take them for surgery. So it's not a difficult task with the good machines we have nowadays. The penetration power is so good when we can map out all the endometriotic lesions and adenomyosis, and we can give them a pre-surgical plan, what we are planning to do. Here comes the role of multidisciplinary team in endometriosis also. If the bowel is involved, bladder is involved, diaphragm is involved, or a thoracic endometriosis is there, if you have a team ready, any kind of endometriosis we can deal with. So when we take a patient for endometriosis surgery, we do take their consents for wherever we will find endometriosis, we are going to remove it. So that may involve any organ. So we have the team ready. If anyone is there, I'm the gynecologist who will be guiding them which tissue is not normal, and they can help me remove it from any site.
Good.
Most of the bowel and bladder endometriosis, we only deal with it, but unusual locations like diaphragm, liver, definitely specialist should be there, and we can tell them which one is the abnormal tissue and they can help us remove it.
Makes sense completely. Living with chronic illness can sometimes really feel like the biggest challenge ever. It can be demoralizing, scary, isolating, frustrating. A lot of people, Shruti, you will agree with what
Yes.
I'm saying right now. But at the end of it, there is hope. Accept the things we cannot change and try to change the things we can. Like Shruti said, diet and exercise. Identifying these things and acting on them may bring some sanity to the insane situation that we are in. So, Shruti, it was like a lovely conversation we had. Any parting words for our viewers?
I think I would just like to end by saying that pain is not normal, no matter where you feel it. It doesn't have to be in an organ specifically for women. It can be at any part of your body, but please don't let anybody tell you that you should accept the pain. Pain during your periods is not normal. Heavy bleeding is not normal. You losing your life over it is not normal. Painful sex is not normal. Nothing related to pain is normal. Pain is a sign that something is off. So if somebody does not believe you, if your doctor does not believe you, please change your doctor. There are options out there. And so I think that that's what I tell everybody, that please don't bear with pain because you're not supposed to.
Absolutely. Absolutely. Pain is not normal. That's something which every person has to learn. Every person.
Yes.
Awesome. Thanks, Shruti. It was so lovely having you over, talking about this journey of yours. Probably a lot of people will take back a lot of strength from you.
I hope so. But thank you so much for having me and giving me this opportunity to advocate further, which is something I'm always ready to do.
More sessions in future.
Yes.
And Vimi, thanks again. This was again a nice session that we had. And thanks to all our viewers who have been with us watching this live, and to everyone who would watch the recording. Thanks and have a lovely evening ahead. Bye-bye. And take care.
Thank you so much, Shruti. Thank you, Shilpa.
Thanks. Shruti, more power to you, girl. You're like awesome.
Thank you so much.